right? Hi. So when I made this presentation, I thought it was being very original, using cars. I usually use animals. This time I thought I'd get some cars in. But yeah, so I've already seen this particular picture, actually. I think it's the first one that comes up in Google if you Google, red Ferrari. But why is it here? I was actually having dinner with my family the other night, and we were having a conversation, and I asked my family, if you had a Ferrari, what would you do with it? And my husband said, I would take it to Germany. I would go to the Autobahn, and I would drive 300 kilometers an hour. And I'm like, well, that sounds good. I asked my 19-year-old son, who also has a driver's license, scary as it is, and he said, well, I would drive it to Amsterdam, and I would go and pick up girls. So I took the car back to the dealer because we all know that my son was actually the only one speaking the truth. And yet, look, Ferraris are very charming and sexy, and everyone wants one. And when you ask people what do you want to do with it, one thing they do not say is that they would love to take it grocery shopping. And this is actually a quote that is not mine. I wish it was. It's not. It's an old quote done by Bora from ZS Consultancy. And he said, look, pharmaceutical organizations, they actually have this Ferrari in their garage, but they're using it to go grocery shopping. Now, if you looked at the title of this talk, I'm sure you understand that I'm now talking about medical affairs. Because I strongly believe that we are using the Ferrari that we are as a grocery shopping car. So as an introduction, my name is Maaike. I'm based in the Netherlands. I have worked in medical affairs pretty much forever, since 2002, so I've been around for a while. A lot of different companies, different roles, different countries. But for the last 9 years now, I have been focusing on development and training of medical affairs teams. And in that capacity, I travel the world and I speak with medical affairs teams all the time. And this particular thing is something that keeps coming back in the conversations. Actually, I often say when we do a training session, it's sometimes almost like group therapy. A lot of medical affairs people are fairly frustrated because they feel, I can do so much, but I'm actually asked to do other things, and I'm not invited in the places where I think I can make the biggest impact. So that's really what I'm trying to do here today. I have 20 minutes. I'm hoping to get you guys, because I'm very aware you're not all medical affairs people. I'm trying to get you guys to see that a little bit better. So yeah, I think this is where we currently are, probably, or it's probably not that bad. But so this is an article I use a lot. It's from Australia, so I'm pretty sure, Steve, it will be familiar. Yay, good stuff. It's a very good article. It talks about the journey, really, that medical affairs has been on from being a support function, which was really the case when I started, all the way up to being a strategic leader. And it's an interesting one because there were actually years up here, but I removed the tags of what happened in which years. Because what I often do with teams, and I'm going to ask you to do the same, so I'm going to ask you to stand up, please, also to activate you a little bit. And I'm going to ask you, when you look at this, on a scale from 1 to 10, where do you think medical affairs is in this journey from being a support function all the way up to being a strategic leader, which would be a 10, right? So I'm going to ask you, I'm going to count up, and please sit down if you think that's where you are. So we're starting here, or not you, but just medical affairs in general, right? So we're starting at 1, 2, 3, 4, 4 people sitting down already. Whoa. 5, 6, 7, 8.
No. You need 10 and then 9, 8, 7, and then I would sit down.
Okay. Okay, good.
We came to here and then we went back
Oh, that's an interesting one. I do want to speak with you later. I would love to hear more about that. So yeah, I saw some people sitting down at 4 already, and I also saw some people standing up a little bit longer. So I do this every time I work with the medical affairs team all over the world, and usually I end up with a meager 5 to 7. Rarely ever do I get like an 8, okay? This is a signal, right? Because the original article actually says we should be here already, I think about 5 years ago. And if we read McKinsey and we read maps and we read all the visions of the third strategic pillar, we should be there already. And we're not. And I think this is important because there's the vision and the beautiful words, and then there's reality, which is where especially our local MSLs are living. And that can be really disheartening. And sometimes it hurts because people start to think it's them, right? I'm failing, I'm not being that. And, but it's not them, it's really the system. And I thought it was very interesting, the previous presentation where they were saying, look, the reason the rep is still so central to the whole organization is because the people that are the general managers and the CEOs, they used to be the reps themselves. And I actually say exactly that about medical affairs as well. We used to be supportive, so all the systems are geared towards that, right? The company is not really ready for us in the way that we could be. So why is medical affairs as a non-promotional role such an important asset? I'm on LinkedIn a lot. I talk a lot about medical affairs, and I have a very, very strong belief that the fact that we are non-promotional is actually our biggest selling point. And I strongly believe we should maintain it. Now, don't get me wrong, I do think we need to have business acumen. I do think we need to understand what the organization needs. But within the organization, we are actually the only people who have the privilege that this non-promotional role is giving us. That means we get to speak on a wide range of topics, either off-label, reactively, obviously, but still, we talk about disease, we talk about, quality of life, things like that, things that may not have anything to do with medication at all. We, in many countries, are allowed to speak with stakeholders that no one else is allowed to speak to, nurses, patients. Wide range of activities, studies, early access programs, things like that, that make a really, really big impact. And also, because of our role and our title, we often step into the door with a little bit more trust and respect than some of our colleagues. We still have to, be that, obviously, but we do have that advantage. At the same time, obviously, if you know your medical affairs people really well, we have that deep scientific expertise. Are we smarter than salespeople? No, we're not really. But we are exposed to science much more than anyone else. At the same time, we're also having these discussions with real key opinion leaders, so that builds our knowledge over time. So we may start off at the same spot, but it does build up. And finally, never underestimate our networks. We have a broad external community. We have the KOLs. We have, all the people that make the difference. We also have a very broad internal community. We know the people from pharmacovigilance. We know the people from R&D. Hopefully, we have them on speed dial, and that makes us very, very powerful. Now, eventually, that will lead to a lot of good stuff, which you can read yourself, but I'm sure you can also imagine what that could be like. There's a lot of data out there, and I'm using the word data in a bit of a liberal sense, because obviously this is not a randomized controlled trial for the medical affairs people in the room. But it has been shown that having medical affairs involved early is going to lead to much better commercial outcomes as well. And we like to word it differently, but in the end, without us, that would have been much more difficult, especially in the pre-launch situations, but even in the more mature phases, there's so much value we can add because of those privileges and because of that knowledge. I see some people nodding, starting to feel good about that. Good. Why is this picture up here? What do you think my message is here? Who's brave enough? Sorry? My message here is, please, if you want a real Ferrari, get a real Ferrari. Don't try to make some commercial role into medical. Don't try to make medical into some commercial role, because this is what you're going to end up with, and it's not a good look. The credibility that we have and the privileges that we have can only be protected if we are truly, truly medical and we truly have that non-promotional role. Again, the business acumen has to be there, but please allow us to really make the most of that role. Don't try to stick on commercial stuff, or the other way around, get commercial things and put on medical stickers and then try to pretend that that's what it is, okay? We need that pure form in order to perform as well as possible. Just checking time, doing good. I want to have a word about business acumen as well. I very often hear that medical affairs does not have business acumen. I sometimes hear that an interaction done by medical is wasted because the product was not mentioned. And I need to be really, really clear here. Of course, yes, there are medical affairs people who lack business acumen. They can be taught that. They need to be involved within the company to start to understand what is needed. They need to understand their role well enough to know where the biggest value of that is. However, I do think that in many cases, our business acumen is really, really strong. And we make decisions based on what is best for the company and best for the patients. And we do things that other people may think are not going to make an impact. So you did not mention the product. You did not ask for a commitment at the end of the conversation. And we do that on purpose because what we do, we feel has a much bigger impact than that. We do this on purpose, but we're very, very bad at explaining that to people. This is something we are genuinely really bad at, internal communication. But please trust us that we know what we're doing it on purpose, and we are making an impact. So let's talk about this impact. When we look at a nice sales graph, right, that hopefully right after launch is already going up very, very quickly. In many cases, or in most cases, what is underneath that is actually the sustainable, strong foundation that medical affairs has been laying out, starting before launch, all the way through. And this foundation exists of, depending on obviously your product and your market and how you're working, it exists of KOL partnerships, credibility, physician knowledge, possibly some real-world evidence, things like that. This foundation is indispensable for the success of the company. And if you allow us, we will build this foundation as steep as we can. The more power we have, the higher this ramp is going to be, and the easier it's going to be to achieve a really good commercial outcome. Now, one of our issues is that if we look within the company, in the short timelines that we usually try to determine if someone has been successful, yes or no, which is usually like quarterly, the difference that we make is not going to be very big because this is a marathon. This is a long-term sustainable situation. So in 3 months, maybe even in 6 months, that difference is not going to be very easy to see or measure. However, over time, this is what you end up with. This is what's beneath that success. And we do that by being non-commercial. Good. So even if you are a total loser, you can look really good with a Ferrari, right? And I'm not saying you guys are losers or your products are losers, but you need to let that Ferrari do the heavy lifting for you. And I just have a few tips for you on how to do that. We need to be that true strategic partner. This means that we should not be receiving brand plans with the message, can you please complete slide 23 and 24 with your activities? That is not strategic partnership. That is just adding in activities. And usually that is followed up by, we assume you will be doing 2 advisory board meetings because you do that every year. That is not strategic partnership. We need to be at the table from the start. Now, one of the hard things about medical affairs is that, in a way, we are not our own best advocates. Medical affairs people themselves can be really reluctant to be there. It's scary for them. They're not sure how to do this. So for them to step up and say, I want to be involved, is a little bit hard. So it takes 2 to tango. But it's very important that we are there from the beginning, providing insights, having an input in the shared goals that we make. And it's completely possible to formulate shared goals that are 100% compliant for everyone to adhere to. This is not hard. This is wording. We can do this, okay? So that's the first one. Second one, I already mentioned it, trust our business acumen. We may look like we're just dallying around and just kind of talking science and being nerds and stuff, but we are making that impact and we are doing it on purpose. We know exactly what we're doing. If you feel your team does not know what they're doing, you need to help them. You need to help them understand exactly where that impact lies. You need to help them speak the internal language that is being used in a pharma company that medical people are finding a little bit hard. Okay? So trust us and ask the questions and don't assume. There's places only we can go. It's the off-label situations, it's the stakeholders, it's the places where high credibility and high scientific knowledge is really, really important. Let us go there. Don't send us to places other people can have an impact as well. We need to complement each other. We've been speaking about sales reps. There's been a lot of talk, obviously, about omni-channel. There's place for everyone there, but make sure that we go to places no one else can go, right? That's where the biggest impact is. And finally, again, we know what we're doing. Some of our activities are very long-term, right? We start a study now, we'll have the results 2 years from now. But we know that, we have that long-term view. This is what we've been taught to do, right? We think long-term. So if we decide that this is a good idea to do that, let us follow our own track. Have a bit of faith. Give us a bit of, space to do the things that we do. And if you do that, hand us the keys, watch what happens. And I can guarantee you, we will drive to Amsterdam. We will pick up the key opinion leaders. We'll take them to the Autobahn. And we will be driving 300 kilometers an hour with them, and we will be making that impact. You just need to give us a little trust. Yeah. We have 3 minutes for questions, if there are any, or criticism, because I'm actually looking forward to that as well. Yeah, Yasin.
I always like to start with why, so that's the logic behind my question. What problem is medical affairs solving?
The biggest problem medical affairs is solving is trust. I think we are like with a built-in level of trust already from day one. The fact that we do have that scientific expertise and we are able to talk about things that are not product related because our KPIs don't force us to do that, I think is what keeps building that. Yeah, thank you.
Where would you see medical affairs in 5 years, 10 years time?
I do see them as the third strategic pillar. Well, actually not necessarily the third strategic pillar, because I think the whole thing with R&D and commercial and medical is a little bit weird. I don't know where market access went, by the way, because I think they're really important as well, but as a true strategic partner. But that starts with us being part of the whole planning and making decisions that really make a difference. And yeah, that's where. So I think we're heading there. We're going slower than we were hoping. Dan?
If you fired all of the commercial team
Yes.
and only had medical affairs,
Yeah.
how much effect do you think that would have on sales? And what do you think would happen the other way around? So if you fired all medical affairs.
Okay. Oh, nice question. To be honest, I think it would be a really good idea to fire sales. I think if we combine medical affairs with a very good digital strategy, because obviously the discussions we have take time, right? We don't have the bandwidth and the resources to cover everything. But if you combine medical affairs, I think, with good digital communication, then I think that would be amazing. I do think there still needs to be marketing, but I think we can do the work for the communication in the field. The other way around, I think we would lose a lot of trust, and I think we are seeing access go down already. It's also hard for medical. It's not like we walk in and everyone's applauding, but it's better than what we're seeing with sales.
Can I ask a quick follow-up?
Yeah.
What
Yeah.
I think feels strange is because obviously medical affairs is becoming more strategic, and
Yeah.
there's clearly a lot of value done pre-launch that shapes the market.
Yeah.
And there's a bit of a
Yeah, no, but
It's a strange concept, I think.
yeah, no, but it's not. Being more strategic is not the same as being more commercial. It means that we use the role that we have, the privileges that we have, more strategically. That's all. I don't think, to be honest, I don't think there, and I know you don't think that either, that a physician is going to be like, oh, now that you showed me this detail aid with this graph, I'm going to prescribe it to everyone now. It doesn't work that way. The way we do this is by, increasing awareness. I heard someone say yesterday, we need to work on the system, the health system, and not on that physician. So I truly don't think there is a place for people saying, here's the detail aid, have you seen this sort of thing? I don't think it works, to be honest. Yeah. I don't know if we have time. Last one. Yeah. Yes.
should not mention sales and medical affairs in the same sentence. Let's do the column in front. I'm
Yeah.
working in pharma business. That's how it works. Okay. But the truth is, in many therapeutic areas, science, point, sales, point.
Yeah. No, exactly, and that's it. In Dutch, we...
Sentence, okay?
Yeah, in Dutch we have this saying, and then I'll stop. We say, okay, medical puts the ball in front of the goal. We like soccer, right? And then sales can come and kick it in. And I'm like, it's already in. Like, we already made the goal immediately there. We don't need someone to come and finish the job. We have already done that. So yes, I think there's a huge contribution there. And a good future for medical affairs. So I'll need to stop now, but come find me if you want to criticize. Thanks.